Okay. Hello, everyone. My name is Diana Aragon. My Capstone project partner is Shelby Weber. And the title of our project is Assessing Rise and Occurrence of Human Immunodeficiency Virus in the Geriatric Population and Implications for Testing. For this project, we wanted to take a look at HIV virus among the specific population, those age 50 and above, and further analyze the current diagnoses and screening guidelines for this population, risk assessment, rate of progression to AIDS, and late diagnoses that are ultimately affecting their mortality. So human immunodeficiency virus interferes with the body's ability to fight off infection and disease, and if it's left untreated, it leads to acquired immunodeficiency syndrome, which is commonly known as AIDS, and that is a fatal condition. The outcome of infection and duration of the disease and clinical symptoms vary greatly among people. Typically, it takes several years for the primary infection to develop any symptoms of HIV and immunosuppression. For this reason, a lot of times these patients don't know their HIV status, and that is what is also leading to late identification and diagnoses. The current screening guidelines set by the CDC say that patients ages 13 to 64 are to be tested for HIV at least once as part of their routine health care, and annual testing for those who exhibit high-risk behaviors or that live in high-risk areas. Our statistics show that there is an increased number of late HIV diagnoses for patients above 50 and a faster progression to AIDS, mainly due to the patient's lack or knowledge of their HIV status, their perceived risk of getting an STI or HIV, also a lack of identification of risk factors by providers, mainly from lack of comfort from either the patient to discuss their sexual health with their medical provider, and also a lack of awareness or education being presented by the healthcare providers on the topic, and the providers also lowered perceived risk of these patients and their high-risk behaviors. Um, the lapse in identification of the risk factors and the current testing guidelines further make this population vulnerable for acquiring HIV, and we focused our research on whether this omission is what's ultimately leading to increased mortality from AIDS. For this project, we did a literature search. We focused on current guidelines, the effects of HIV on this specific population due to all their other comorbidities, current risk assessments and the approach taken by healthcare providers to assess these patients, and the mortality rates. We try to focus on patients here in the United States, and we use research that was current or within the last 10 years.
All right, so our literature review or evidence-based research project showed that an estimated 83.7% of sexually active adults over the age of 50 in the United States have never been tested for HIV at all. The lack of awareness of personal HIV status is due to a lower likelihood of adults over the age of 50 to be tested for HIV, even when they are engaging in sexually risky behaviors. A study that we found assessed sexual risk among older adults, and it determined that half of the study sample disclosed engaging in vaginal and or oral sex, 49 and 43% respectively, without condom use in the past 6 months. Nonetheless, that in that same study, 2/3 of that sample reported that they were not susceptible to HIV or sexually transmitted infections. Additionally, data was collected on risk assessment, and it showed that health professionals are less likely to discuss sexual practices to identify sexual risk factors with older adults, as Diana had mentioned earlier. This may be a lack of education by healthcare professionals, and also just a lack of perceived risk by this population, even when they are engaging in known sexually risky behaviors. Um, a study was completed to determine healthcare interaction and HIV related perceptions among elderly patients, which showed that out of geriatric patients that visited a physician at least twice in the last year, only 30.9% had discussed sex at all with a physician since turning 50. Lastly, reported cases of HIV infections to the CDC in 2009 showed that 14% of persons less than age 25 had progressed to AIDS within 1 year of initial diagnosis of HIV, compared to 49% of people greater than 60 years old, which you can see in the graph that we have to the left. Um, and in conclusion, increased awareness of high risk behaviors among patients as well as healthcare providers can lead to a more efficient assessment and overall education to prevent increased HIV and AIDS mortality among this older population. The increasing rate of HIV infections, as well as higher incidence of progression of HIV to AIDS at the time of initial diagnosis, serves as evidence that the current screening guidelines um, have adversely affected this patient population. Given the evidence presented in our research, um, an extension of the age range of those screened for HIV should be strongly considered to include the geriatric population, patients older than 65. Um, the lifespan of people has, greatly improved, and medicine is improving. So just because you're older than 65 does not mean that you should not be screened for these diseases. There would be an overall benefit to highlight and address these gaps in health risk assessment, sexual practice education, and disease screening tools to battle this public health challenge posed by HIV and AIDS.
So, Shelby was saying overall, we would just benefit from more research. Although we did find some research on this topic, there was very little focus on this specific population. Um, Also, a recommendation would be to further educate healthcare providers on the actual statistics and these high risk behaviors that these patients are taking part in so that they can educate their patients and we can raise the awareness of HIV infections among these patients. Also, like she said, a consideration for extending current guidelines. We found that the omission of this population is directly affecting the progression of HIV to AIDS as patients are being diagnosed very late in the disease and in turn increasing their mortality from AIDS.
All right, so that concludes our research project on HIV and assessing risk in the geriatric population and implications for testing. If you guys have any questions or anything, feel free to reach out to Diana or myself. And we hope you enjoyed our project. Thank you so much.
Hi, thank you.